The Journey program on UBC TV is brought to you by Plascon, Color Your World.
Hello viewers, my name is Henry Magala, the Country Program Director for AHF Uganda Cares. AHF stands for AIDS Healthcare Foundation. This is the largest organization in the US providing HIV services globally. AHF Uganda Cares began in the year 2002. And at that time, providing medication to people living with HIV was very, very difficult. You could not access drugs anywhere. So in that year, the president of AHF called Winston Michael attended a Great Lakes conference that was organized in Entebbe. And so it happened that even the president of Uganda, President Yoweri Kaguta Museveni, attended that meeting. And in that meeting, the discussion was around how do we access treatment to people living with HIV. And so at that time, the president attended and they had an interaction with the president of Uganda, where the HF president, Michael Winston, promised that it is possible to provide medication to people who are living with HIV and in public health setting. At that time, HIV drugs were not available. I think they were available in a few centers. You remember the Joint Research Council? That's why it was. So a discussion ensued around that, and the president of AHF promised the president of Uganda that we can begin a collaboration, between HF and Ministry of Health, Uganda government, to provide drugs. So in 2002, the collaboration took another level where the HF president promised that he's going to provide medication for the first 100 clients. So in that year, 2002, AHF, in collaboration with Ministry of Health, began the first ART clinic, HIV clinic, in a public health facility, and the decision was taken that it should be sited in Masaka Regional Referral Hospital. And I think to all of us, we know why Masaka was chosen. This was the epicenter of HIV. And so HF began its program of providing HIV treatment in Masaka Regional Referral Hospital. So the vision of HF is to achieve global control of HIV and AIDS, and its mission, which is also shared by AHF Uganda Cares, is to provide cutting-edge medicine and advocacy regardless of ability to pay. By this advocacy, without ability to pay, AHF tries to provide the best care available at a particular time to our HIV clients. So cutting edge in the sense that AHF in its global program tries to give the best care available at that time. Although in the context of the country, it's somehow modified because what's available in the West may not be applicable here. So we have instances where AHF has taken a lead in providing cutting-edge medicine. In terms of medication, it was the first program in Uganda to provide medicine like Truvada, which was a better drug at that time. So AHF has several programs, and some of the programs include care and treatment. We began the 100 clients, and what we did was provide the drugs, certainly, but we also made sure that there were human resources available. We ensured that there were nurses, there were doctors to treat the 100 clients. So key program of AHF Uganda Cares is care and treatment. And in treatment, as I said, we provide the medicine, we provide the human resource, but not only that, we also look at what does it mean to put a client on treatments. So the issue of diagnosis, laboratory services is all key in this area. So key program of HF Uganda Cares is care and treatment. It began in Masaka, and then we have seen it grow across the country. From Masaka district, the program has expanded to 28 districts, offering care to now currently 150,000 clients in 64 health facilities. So that was the beginning. The beginning was care and treatment in 2002. But later on, we saw that there are more clients coming into the clinics that had been established. So AHF in 2008 said, I think it's better to prevent the new infection. So what AHF did was to ensure that a prevention program begins. So prevention is the second program of AHF, Uganda Cares, whereby the key intervention that AHF began with is ensuring that people know their HIV status. So testing, counseling and testing was a key program that was added to the care and treatment program. We are seeing more clients coming up in the clinics that we had begun. We began in Masaka, we went to Kyotera, we went to Karisizo, we went to other health facilities. But beginning with 100 clients, we saw more clients, HIV clients, coming in. And we said it's important that we put an end to the new clients that were infected with HIV. So the issue of counseling and testing was key. HIV counseling and testing is very important. It's a very important program that HF began after the care and treatment program, because when HF found that more people were being infected, it came out with an initiative to ensure that we don't have new cases coming up. The issue of allowing people to know their HIV status, because once they know their HIV status, they are able to keep, either if they are negative, they are able to keep that status. And those that are positive, there was a way for them being enrolled on care and treatment, being put on drugs, helps them to live longer and more productive. So the prevention program was initiated to ensure that we cut off the new infection, the increasing level of infection that was being experienced in the new clinics that had been set up by HF Uganda Care. So counseling and testing was very key, and reflecting on the cutting edge medicine, HIV Uganda Cares at that time introduced a 1-minute test kit called Insti that allowed people to know their HIV status within 1 minute. It's called a rapid test. So that made an encouragement to those that were fearing and those who are thinking that it takes a lot of time to get tested. So we saw a big number of people coming up for HIV testing. And during that time, we had instances where in a day, because of mobilization, 1,000 people could be tested, 2,000 people could be tested because of that cutting edge kind of test kit, very fast and also precise. So that began the prevention program. Counseling and testing was very key, but also other interventions were introduced. HF Uganda Cares was one of those programs that began to talk about the condom as a prevention tool. And at that time, there was a lot of hesitancy, there was a lot of stigma around using a condom. And so, because HF Uganda Cares is after ensuring that there is control of HIV and AIDS, HF Uganda Cares stood the ground and we promoted use of a condom. The condom is effective because once you use it consistently and very well and regularly, the chances of getting infected with HIV are reduced between 90 to 95%. So it's an effective tool. So HF began the campaign regarding condom use. And you see that from that time, 2008, condom use and education began to take place in the country, and the uptake has been good. So that's part of the prevention intervention that HF has undertaken. But certainly, there's the entire issue of educating the public about the dangers of HIV and how you get it. So Uganda Cares has been at the forefront of providing public education about HIV, how it's got, how it's transmitted, and how it's prevented. Reflecting on our mission, providing cutting-edge medicine and advocacy regardless of ability to pay, all the services that are provided by AHF Uganda Cares are free. They are not paid for. And we thank also government of Uganda that the HIV program has been a free program across, especially in public health facilities. As AHF Uganda Cares, there are many things that we have achieved and other programs that I could also continue talking about. AHF began the food program. Most of our clients are vulnerable, some of them don't work. So HF in 2012 began what we call a food program, whereby the vulnerable clients that don't have money to buy foods, they have been given supplements of food to ensure that they boost their nutrition status. But not only that, HF Uganda Care has also begun demonstration gardens in some of our key centers, whereby clients can come up and they're educated on how to raise nutritious foods, vegetables, that also help to boost their immunity. And so that's a program that HF has begun, Food for Health. And we have seen clients taking on this and ensuring that they have nutritious food at home. We have also expanded it to greenhouse production of some still vegetables, the green pepper, which is one way of, again, enabling our clients to get nutritious fruits. Secondly, in addition to that, AHF Uganda Cares has undertaken other programs. Going back to care and treatment, it's important that clients are treated in environment that are okay. So in this respect, HF Uganda Cares has tried to improve the environment where clients are served. In most cases, when you go to public health facilities, HIV clients are located, not the best places or spaces where the clients are served. So what HF has done is sometimes remodel those spaces. Sometimes HF has had to construct new buildings, clinics, so that the clients are, treated in environment of confidentiality. It also encourages them to come back and, get the service when they are, treated in a decent environment. So infrastructure development has been a key area of HF Uganda Cares. Critical again to care and treatment is the issue of human resource. HF has been able to ensure that at any point clients are received well, so a nurse is very critical. In all our supported facilities, we have been able to hire nurses. We have been able to hire clinicians. They are very important in providing care. And in big hospitals, big health facilities, we have hired doctors. So right now, AHF has 480 staff, and 60% of these are health workers, medical workers, and other health workers in the areas of counseling, laboratory services. So providing human resources has been a key area of HF support. Lastly, about care and treatment, HF has been able to provide services that reduces stigma. We have enrolled peers. Peers are clients, HIV clients that have come out positively, and they are able to encourage those that are still fearing to take their medicine to test. And this one have been a very big force ensuring that clients are on treatment. As an organization and establishment, there have been challenges, and one of the challenges has been retaining the clients that are enrolled in care. Retention has been a challenge. You find that when we enroll 3 clients, we often retain 1. The 2 get lost. They are not found, but sometimes they are not lost, but they have transferred in other health facilities. So when you spend resources to test, begin clients on treatment, you want all of them to be in care and treatment, but this has not been easy. It's not possible. So others transfer away. Others have issues, economical issues, so they have to move to other places and be able to, get a living. So it has been a key challenge. And others just, decide to take what we call a drug holiday. And that's not good, because when they come back, they have advanced HIV and AIDS diseases. This is where their condition is worse. Their viral load, their immune capacity has been lowered so much that they are now sick. You have to treat them from many infections, including TB and other diseases. So the second challenge has been ownership of this response. We see in health facilities, for example, I mentioned the issue of improving the environment where clients are being treated. We come out to say, let's improve on the infrastructure. Can we get a contribution from the district? This has not come out easily. And for us, we are saying it's a challenge, because HIV response should be owned by the country. And so that's a challenge that we are facing as a program. But also as a program, increasingly we are hearing that, it's true that donor funding is reducing. So as it's reducing, donors are reducing on their support. In some of the facilities that we are supporting, we are seeing human resources that has been provided by donors being reduced. The challenge here is that if we are provided 2 nurses and the donors are provided an additional 2, when the 2 are taken away, the 2 that remain, that belong to Uganda Cares, will suffer a heavy workload. So these are some of the challenges that we have as a country.
Tuli ku ground, Blascon, paint and win. This year, Blascon paint and win. The ground. Chicho, buy paint worth 100K. Get a scratch card. SMS the code 27197. Stand a chance to win instant airtime, 1 million shillings bully day there, or a share of a 3 million shillings jackpot each week. What do you want the brand new bodas, tuk-tuks, and so much more? Catch the paint and win action every Monday on Bukede One, NBS, and Sanyuka TV. Blascon, color your world.
As a program, there are critical achievements that we have achieved. Putting 152,000 clients on treatment means a lot, because the 152,000 clients live in households. So those are very many people that as an organization we have impacted. Certainly the 152,000 looked after in collaboration with the Ministry of Health, in collaboration with other implementation partners. So this is a huge challenge, because the 152,000, these are our heroes. These are the ones that have understood what HIV is, and they are ambassadors in this program of achieving AIDS control, because they are the ones that will talk about HIV to other people that are still skeptical about testing, about enrolled, and they also share their experience. And that experience, in most cases, helps other people not to, get HIV. So that's a big impact to us as an organization. Certainly, as an organization, we have been able to enable the country across to hear about HIV, to hear about what it means to live with HIV through our different programs, advocacy program. Meaning, as a country, Uganda Cares has been able to put across the message about HIV, and therefore we can say that most of Ugandans are sensitized about HIV. So those are critical contribution of HF, Uganda Cares. As an organization, our vision is to achieve AIDS control, and our mission still stands, reaching out to those who are unable to pay, and there's still more people that have not accessed treatment. As a country, we see that about 94% of those people that have HIV have 94% of those that have HIV have gotten to know about HIV, so there is 6% that hasn't known about HIV. And so as a program, we continue with our prevention program, we will continue with our even treatment program. So as a country, beginning from next year, we'll expand to 4 more districts in Central, in the North, to ensure that more clients, more people get to know about HIV, they test, and then they get decent treatment, they get good treatment, which HF Uganda Cares provides in collaboration with Ministry of Health. So that's a key program for us. We'll continue to treat the 152,000 clients in collaboration with Ministry of Health and other implementing partners. World AIDS Day took place. It's an important event because everybody is reminded that HIV is still an issue. As HF Uganda Cares, we are saying that it's not over. That was our theme, and this is critical because right now you see that we still have more new infections as a country. 38,000 new clients, new HIV infection we are registered in the past year, which means that HIV is still an issue. 38 new HIV infections were registered in our country for a period of 1 year, ending June this year. So that is too big a number. And when you look at the death, there are 20,000. HIV control, we can say it's controlled when you have lower new HIV infection compared with the death. But now we see that the new HIV infection are more than the death. We can only see that we have achieved epidemic control when the new infection are either equal or less than the new deaths. There we can say that we have achieved epidemic control. So 38,000 new HIV infection against 20,000 deaths shows that as a country we are still at a loss in terms of achieving epidemic control. So this was our commemoration. It's not over because we have that situation. But again, more so when you see that 30% of the new infection happen among young people, 15 to 24. So we are combining our theme with the theme for our country, which was accelerating those interventions that will help us achieve public control of HIV, ensuring that HIV is no longer a threat by 2030. So the celebration were a reminder to us that it's not over and we should accelerate those interventions. And the intervention include HIV counseling and testing, ensuring that everybody is retained on treatment, ensuring that they achieve viral suppression. But also increasingly, as a country, we need to ensure that we own the response. The donors are reducing their support. We are glad that the country, we are beginning to look at how do we sustain this response. And we want to thank Ministry of Health, we want to thank Uganda AIDS Commission for coming out and taking a lead, ensuring that we achieve sustainable funding of HIV. Certainly want to thank the media, UBC critical at ensuring that the public is educated about HIV and how to prevent the response. Our appeal to government, there are so many policies and strategies that have been put in place to ensure that we achieve HIV control, ensure that HIV is no longer a public health threat. One of them is the issue of domestic resource mobilization. As a country, we pronounce ourselves that we should have the AIDS Trust Fund. We think this is one way to achieve domestic resource mobilization for HIV, achieving ownership, financial ownership, achieving one way, ensuring that the AIDS Trust Fund is operationalized, is one way of ensuring that we have domestic sustainable funding of HIV response, but also we have heard about the national health insurance is one way that the government can raise this money, and so our appeal is that the government comes in to operationalize the national health insurance. Two, the clients, we thank the miracle of science. You can live on drugs, you can live long life and productive once you stay on treatment, and we have seen it. We have those that have celebrated 30 years, 40 years living with HIV. The clients that we began with 20 years with as Uganda Care are still living productively, living with HIV. So let's ensure that to adhere to medicine. And to the general public, the challenge of HIV is still with us. We don't have treatment in terms of cure of HIV, so where there's no treatment, I think the situation is not good. It's not yet over. We cannot celebrate over that. So as a general public, you who have not, if you have not, to the general public, if you have not gotten HIV, ensure that you keep your negative status. And those that have gotten HIV, ensure that you don't discriminate them, you don't stigmatize them. They are very productive people. We have seen them taking on responsibilities. They are living very productive and contributing to national. So do not stigmatize those that have HIV. Do not stigmatize those that have HIV, because they need your support and they are productive and they are contributing. So general public is very critical. There is no cure, as I mentioned, and therefore we should ensure that no one now should get HIV. HIV. And to our viewers, to those that have HIV, yes, I think opportunities have come out, and the opportunities now for you to take a single dose, the DGT, which is a better situation than it was when we were taking 3 pills and even more than that in the previous. So I think with that science coming with us, it is possible for you to take your drugs. Certainly, if you have an exposure and accidentally you are at risk, still the drugs that treat HIV are available. You have heard of the PEP, post-exposure prophylaxis. You are able. We have heard about the injections that prevent the PrEP, but that one, we still have the issue of cost. They are not easily available. Yes, you can take that injection. It can give you a protection over a period of time, 3 to 6, but as a country, we don't have resources as yet. But certainly other areas, you can still use PrEP. You can take the drugs that you have, and you are able to prevent your pattern, if you have HIV, to get HIV. So the issue of young people waiting until you are ready for HIV, for the responsibility of that associated with sex, like pregnancy, is very critical. You don't need to rush into having sex, because right now the statistics are very consistent that 25% of the pregnancies are accounted for by teenagers, which is not good. So young people, you need to abstain. The message about abstaining is still relevant. You need to wait until the right time, because once you go in sexual relations, the chances of having HIV are very high. Certainly the condom still is available. Once you're in a situation where you're at risk, there's no reason why you don't use a condom. It's not that we are telling people that you use a condom and have reckless sex. No, use the condom responsibly. It can help. Thank you for the partners that we have moved this journey with, a journey of 22 years. Certainly Ministry of Health, HF Uganda Cares is a collaboration with Ministry of Health. We are operating 64 health facilities. 61 belong to Ministry of Health. We only have 3 standalone health facilities that belong to HF Uganda Cares. So we want to thank the partners. We want to thank the development partners, especially PEPFAR, USAID, CDC, WHO, UNAIDS. They have supported a lot of work. They have supported treatment of thousands of clients, 1.2 million on treatment. That's very great. We want to thank the partners where we operate, the implementing partners. We want to thank the civil society organization, especially where we're involved in advocacy. HF is an advocacy organization. We want to thank the media. We want to thank UBC for inspiring Uganda in all aspects of health, aspects of life. And now, with this journey of ensuring that we achieve epidemic control, we ensure that HIV is no longer an HIV is in this journey of ensuring our aim as a country to ensure that HIV is no longer a public health threat. We want to thank UBC for working with us. Lastly, I want to send my greetings to my dear wife, Maggie, for the support that you have given me, and our 5 children for the support that you have given me as a country program director, and certainly the team that I work with is an amazing team. You can find me at HF Uganda Cares. We're at plot 54 Kira Road, and my number is 0782 578701. I say all this for God and my country, and God bless. Bye-bye.
UBC, inspiring Uganda.
In a nation hungry for truth, a world where every story matters, there exists a beacon of trust and reliability. For decades, they've been our voice and our window to the world, holding the mirror of our history. With 4 TV stations and 11 radio channels spanning 27 languages, they stand as guardians of information, defenders of truth. With Maskari Heritage Advantage, they uphold every citizen's right to reliable and free information. Their archive stories shaped our past and illuminate our present. Yet now, as new challenges arise and the world evolves, their mission faces its greatest test yet. Be part of our journey and let's navigate the unknown, uncover the untold, and safeguard our future together. Tune into your public broadcaster, for it is the intersection of trust and truth. Because to UBC, your story, every story, and every voice matters. UBC, inspiring Uganda.